Hi, I am Dr. Ibrahim Moghimi. I am the founder of International Academy of Aesthetic Medicine. This is my third case presentation in aesthetic medicine. In this video series, we try to show you the most important complications that may arise after any clinical procedure in your office. You should be very careful to do the best way to prevent these complications. But before you start to inject filler or Botox, I will show you how this complication may arise. The most important factor in this way is to know about the perfect anatomy of the face, about the muscles, nerves, veins, and arteries. There are many different arteries under the skin in different parts of the face. And the main result of complications that may arise from filler injection are from occlusion of these arteries. Some of these arteries may be occluded after direct injection of the filler into them. Some of them may be obstructed after injecting filler on them. When we inject excess filler on a artery under the skin, this excess filler may provide pressure on the vein or artery and may obstruct its blood circulation. This is called external obstruction. But when your needle enters in the arteries or veins under the skin, when you are injecting fillers, you may push some filler into the vein or artery, and you may obstruct the blood circulation in that vein or artery. In this situation, we call it internal obstruction. Internal obstruction is a very critical emergency medicine in aesthetic medicine, and it is shown by paling of the skin in the area and the pain that may increase after eliminating the anesthesia you provided for the filler injection. And you should do as soon as possible to provide the natural blood circulation in the obstructed area. But if you don't pay attention to this important factor, the occlusion in the artery may decrease the blood circulation, and this decreased blood circulation may result in ischemia in the area. Ischemia begins with mottling of the skin, and then little by little the skin will go darker and darker, and after that the third stage of the ischemia may arise through showing you a very strange thing. Some maculopapular rash or pustular rash may arise on the ischemic area. And this shows you that if you do not start your antibiotherapy, it will very, very soon go to a very finally dangerous condition called necrosis. In this video, I will show you the anatomical basis of this process, and then I will show you some of the real cases that I have seen in these years and treated. And now I am honored to show you this very important case. This is the third case, case presentation 3 by Dr. Ibrahim Moghimi. And welcome. Please subscribe me and you will see the new videos very soon. All of these new videos are showing you new exciting cases and complications that should be very, very important for you. And if you don't pay attention to them, someday you may encounter with them, and that may be late. So I invite you to watch and learn. If you have any question, please send your questions to the number I have written in the comment, and I will answer you as soon as possible. Bye. As you see in this video, I want to know the main critical branches of arterial system in the lip and perioral area, because this case is about a complication, an ischemic complication in the perioral area. Actually, a patient went for injecting filler in her lip, and after injecting fillers, ischemic event was started. So we want to know why these ischemic accidents will start after injecting filler. All of these are related to the obstruction of these arteries under the skin. As you know, an ascending artery is going from the down to top to the lip. This is called ascending mental artery. Ascending mental artery will give a branch to the lip that is in a horizontal fashion and goes toward the skin under the lip. This horizontal artery is called transverse mental artery. Then when we go to upper part, there is another branch from the ascending mental artery that is called labiomental artery. So we have an ascending mental artery which has one branch, transverse branch, which goes transversely under the skin with a few distance with the lip. Here, transverse mental artery, and then another one is labiomental artery. 1, 2, 3. And the fourth artery is a fascial artery. We have another artery which is inferior labial artery and superior labial artery. As you know, all of these arteries are in a horizontal fashion, not vertical. In other words, if you want to inject fillers in the lips, you should actually follow the horizontal fashion of the needle insertion or needle injection. If you go vertically, you may cross all of these arteries in the lip, mainly the transverse labia inferior. Labia inferior artery is a semi-sized artery which is branched from the facial artery and goes through the lip in a horizontal way. You never ever use your needle from top down when you are injecting fillers, because this top down technique may puncture the inferior labial artery, which is horizontally under the skin of the lip. Also, you shouldn't inject any fillers under the lip, for example, in the mental crease, in a vertical fashion, because the more injection in vertical fashion, the more the risk of venous or arterial puncture and hematoma and bleeding. Or you may also inject hyaluronic acid in the artery, and in this case I will show you. I want to remember this pattern, which is coming from the lip to the chin, and in our case, which was confronted with the ischemia in her lower lip, this pattern will be seen. This shows that ischemic event was occurred in the lip, and it was expanded to the downside branches such as labiomental transverse and transverse mental artery. So I invite you to see the second part of the video, and we'll see my case according to these academic basics. As you see, here is a ascending mental artery, and then it will give two branches. One is the transverse mental and another one is labiomental artery. When we go upper, we see another branch which is coming from facial artery and goes to the lower lip called inferior labial artery. The main occlusion was occurred here in this case, and I will show you what's the event occurred. As you see, this is a young lady about 31 years old who went to an aesthetic clinic for injecting fillers. The filler was injected in her lower lip, and after 1 week, the lower lip was, its color was going darker and darker with a sharp pain. After that, they decided to inject hyaluronidase. When they injected hyaluronidase, the area was controlled, but the ischemic event was continued from the lower lip to the lower part of the chin until the inferior border of the mandible. As you see, just according to the anatomy I talked about it in the last minute, occlusion of the ascending artery and occlusion of the transverse mental artery. After the occlusion of the inferior labial artery resulted in a very significant area of ischemia. This ischemia was remained for 1 and 2 days, and after that blood circulation was re-established, but there was some PIH, post-inflammatory hyperpigmentation, and bad scars. This is the time of actual ischemia, when the patient referred to the clinic with a sharp, excruciating pain and was very suffering from the bad pain. She could not move her lower lip, she could not talk, and she was suffering very huge pain. And lower lip was swollen with some pus, and as I have heard from my colleagues, they injected some antibiotics, muscular, and also gave some oral antibiotics. Then they followed the treatment of ischemia according to the protocols through using hyaluronidase. But this inflammatory region was remained for 3 months. They also used some ointments for decreasing the inflammation of the skin. The ointments were containing some corticosteroids plus antibiotics. Through the treatment, in the 2nd week, some crusty parts of the chin was seen, and some yellowish discoloration and infiltration were seen on the area, showing the possible staphylococcus infection. This was very dangerous for this patient, and in this way, the decision was to start full dose antibiotic therapy to prevent any nosocomial infections. But I think this infection was occurring because of low attention of the patient or relatives, and after 1 week there was some scars and healing was continuing. I also want to show you such maculopapular pustular rashes. They may occur after any ischemic events in lips. You should be very careful to this clinical picture. When you saw such rashes with white or yellowish contents in them, you should increasingly suspect the infection of staphylococcus infection, and this type of skin infection is very dangerous. You should start broad spectrum antibiotic therapy and check up and follow the patient for 5 to 10 days. This is the sign of bad ischemia. This is the sign of ongoing necrosis. You should control this. If you controlled these rashes, you will be hoping that the procedure is going to the treatment and cure. But if you delay any treatment plan in this situation, the ongoing result will be a dark, cold skin, which is resistant to any antibiotic therapy. In other words, the skin will die and you cannot do anything. So, in any time when you injected fillers and you saw any pain after the day of injection, or you saw any discoloration of the skin, you should clinically examine the area if it is because of hematoma or it is because of ischemia. Differentiation between hematoma and ischemia is very important. I will talk about this differentiation plan in the another video. This was the third case. I am Dr. Ibrahim Moghimi. I am honored to inform you that my fourth case presentation will be published as soon as possible. These are the result of my 20 years experience in aesthetic medicine and anti-aging. If you subscribe us, you will see the future videos from us. And if you have any question, please write them in your comments, and our research team will answer you as soon as possible. Best regards.